Please welcome Health Education Supervisor in the Office of Disease Surveillance for the Southern Nevada Health District, Jessica Johnson, and Bloomberg Professor of American Health at the Johns Hopkins Bloomberg School of Public Health, Dr. Susan Sherman.
Hi, Susan.
Good almost afternoon, everyone. I'm really excited to be here today talking to you about harm reduction and talking to you about vending machines in particular and why vending machines are appropriate for your state of Nevada.
Yeah, wonderful. Thank you so much for having me today. So, vending machines, probably many of folks out here in the room have used them at some point in their life. And in Nevada in 2017, we explored vending machines as a strategy for increasing access to harm reduction supplies. And that was important for us, particularly in Clark County, Nevada, where I live, because Clark County's the size of like the state of Connecticut, and so we really needed to think broadly about how to increase access to harm reduction services for overdose prevention. Our data tell us that folks are dying from fentanyl overdose across our communities, so we really needed to identify strategies to meet people where they're at.
It's great, and it's such an important example of harm reduction, which is many things, including bringing schemes to people where they are, work, live, play, so that it's accessible to people. Can you talk a little bit about who operates the vending machines? What are some of the logistics?
Yeah, excellent question. This wouldn't be possible without our syringe services program, Impact Exchange, also known as Track B. We have one in the Las Vegas area. And so it was really important, as I mentioned before, for them to think about how they were going to expand their services across the community. So they manage the logistical day in, day out operations. They're really the implementers of this program. And as the local health department, we help support them with funding, data analysis and data access, and other opportunities sort of based on their requests. Sometimes it's easier if they're going to present to a new site, if they can have public health backing for some of their harm reduction messaging.
Yep.
These vending machines are placed at social service organizations in our community that are both geographically convenient and also trusted by people who use drugs in our community. So like our LGBTQ center, federally qualified health centers, opioid treatment providers, and we have 2 at our local health department locations as well. And then product-wise, they stock the vending machines with syringes, naloxone, safer sex kits, wound care kits, fentanyl test strips, and other things like that.
That's great. Have you been able to look at the impact of these machines?
I'm so glad you asked about that. As I'm sure you're aware, studying impact can be a little challenging sometimes for these types of community initiatives, but we had the opportunity to partner with Dr. Sean Allen, who's maybe in the audience here today, and we worked with Dr. Allen and Impact Exchange on a study that looked to see if the opioid-involved overdoses increased or decreased after implementation of the vending machines, particularly around naloxone. And I wrote this down because I didn't want to say it incorrectly, but the analysis found that in the year following naloxone dispensation, there were 41 fewer opioid-involved overdose fatalities than predicted by the model. So that was really incredible for our community. We were really thrilled by those findings. Yeah, absolutely.
That's amazing.
Yeah. In addition, anecdotally, we've really seen community service providers and other folks come to the table more excited about harm reduction, particularly harm reduction supplies. So we've given out more naloxone in the last year to a wider variety of service organizations than ever before, and those types of initiatives.
It's great to see how one intervention can be the vehicle for other interventions.
Definitely agree.
What about policymakers? How have they felt about these machines in their communities?
Yeah, I'm glad you asked about that. In true harm reduction mode, we flew a little bit under the radar initially, some of that by community, for community, but we've been able to translate this both at the state level in policy and local level. So advocates in Nevada were able to change laws to expand access to drug checking. And then locally, we were able to use these findings at the city and county level and presenting to them about implementation of vending machines in these communities to local elected officials. Some of the work that helped guide this policy was actually, believe it or not, from the forecast study that you worked on around fentanyl test strips. It really helped us to dispel some of the myths about how people who use drugs use fentanyl test strips as a drug checking tool. Can you share more about the impact you've seen from that study?
It's always great to hear that our work is useful, because that's really the point of what we are doing. The forecast study, which was conducted in 2017 in Baltimore, Providence, hello, this side of the room, Baltimore, Providence, and Boston, and we validated several different tools, including fentanyl test strips, to test can they accurately show when fentanyl and other substances were and were not present. We also interviewed people who use drugs to see were they interested in drug checking. Had they used drug checking, how would it be to use these strips before they use drugs, after they use drugs? And I want to say that we knew that fentanyl test strips were being implemented on the ground by a lot of activists, people taking a chance because drug checking wasn't necessarily decriminalized in their jurisdiction, but we thought it was really important to provide evidence that showed that, in fact, these strips were accurate, which is what we found. And it was a time on the East Coast in Baltimore that fentanyl was really the driver. It continues to be, but it was skyrocketing in 2017, the driver of fatal overdoses. And we were happy to find that, in fact, they worked, they were accurate, and we also helped decriminalize drug checking in the state of Maryland, which we were happy about.
Yeah, that's really incredible. So I know that study you mentioned, 2017, are you doing any current work on drug checking?
As you would say, I'm so glad that you asked. We have a NIDA-funded study where we actually have a mobile van going out with an FTIR machine. It's a machine that tests the contents of a substance and can show the relative percentage of what's in the substance and lots of different drugs, including fentanyl. This is run by Danielle Nestad. It's called the Check It Intervention, who was sitting right there before, but I'm lucky enough to work with Danielle. And we actually are going to have this machine to provide point-of-care drug checking. So people can come on the van, bring a baggie, bring a small substance, and within a few minutes see the results and make informed decisions about what they used, what they're going to use. It's an overdose prevention and HIV prevention study, so we also have a mobile nurse on the van, a nurse on the van to provide pre-exposure prophylaxis for people that wanted who are HIV negative, and also to take care of wounds, because xylazine is really now the next substance in our drug market in Philadelphia, other cities. People have gaping wounds. Xylazine is a horse tranquilizer that's not approved for human consumption. It's made its way in the drug market. And so we're really happy to be able to provide wound care in the field.
That sounds really exciting and will yield a lot of important translatable results for many communities. Can you share why this study and others are important to bring policymakers on board to inform humane and evidence-based drug policy?
That's like the best last question. I really believe this, and I've always believed this. As researchers, being so lucky to, for me, being at the Bloomberg School of Public Health, having access to the Bloomberg Initiative, it's our responsibility to conduct really rigorous research that can be consumed by activists, program folks. Like, why else do we do what we do? And there's so many. I really encourage all researchers, no matter if this is your first year or your 20th year, in which case you've probably already done this, work with community advocates. So many advocates have been doing this work already for so long. Oftentimes, we're not working with them yet, or we think we can't approach them. I bet Sam can attest, researchers can be useful if you work in partnership, and it really is our responsibility to do that.
I absolutely agree. I think identifying strategies to translate this work can help others help inform these evidence-based policies and support folks like me at a local level in working with our communities to translate the findings to more evidence-based drug policy and work.
Thank you.
Thank you.